Good morning, Dr. Conville Brand, and welcome to the Ministry of Health. It is my pleasure to welcome you and to receive the donation from the Monks and Rogers families. For nearly 50 years, the Bahamas has enjoyed an abiding partnership with Canada, and it is my understanding that early on in the COVID-19 pandemic, when similar to the rest of the world, our necessary medical supplies were declining, two Canadian families decided to assist our healthcare system by procuring many sought-after ventilators. Valued at just over $100,000, they were able to secure 4 dual electronically and battery-powered ventilators. 2 of the ventilators are being donated to the Ministry of Health today, and 2 are Grand Bahama bound to a private healthcare facility. Currently, in our public healthcare system, there are just over 90 ventilators available, with 15 at the Rand Memorial Hospital and the remainder here in New Providence. For decades, the ventilators has been a fundamental element for intensive care units and emergency medicine care. As much as hoped that those assessing our healthcare system will never have to use a ventilator, the reality is that emergencies constantly occur. Having an increased capacity to assist in saving more lives in this regard is invaluable. So on behalf of the government and people of the Commonwealth of the Bahamas, the Ministry of Health extends gratitude for these donation of ventilators from the Monks and Rogers families. Their generosity aids in our country's overall healthcare advancement and is especially beneficial during this pandemic, where so many have needed the assistance of a ventilator to survive. Thank you, thank you, thank you for your support and your kindness. May God continue to bless you, and may He keep you and your family safe. Again, I say thank you to the Monk and Rogers family for such a most valued and valuable donation. Thank you. Dr. Brown.
Well, thank you very much, Minister and colleagues. It's absolutely a pleasure, one, for the friendship of the Monks and the Rogers over the years, and so I was very much delighted, several months ago, when Dr. Bernie Gosowitz, who happens to be like the family physician for both families, and he said, Conville, we have to do something to assist, and we're thinking of a few ventilators. And I said, well, they ain't the easiest thing in the world to get. So they couldn't exactly get them in North America, and so they actually went all the way to Austria to secure these ventilators. I've had a number of anesthesiologists, local heads of anesthesia here in the Bahamas, as well as a senior cardiac surgeon of world renown, take a look at this technology, and they were extremely impressed. So we're setting up a program now, and with the fancy ventilators we thought we were getting, they were actually supplanted by these less expensive, much more versatile and smaller ventilators that very much fit utilization in our archipelagic country, where we have to go from island to island by plane or by boat. And so if someone's being ventilated, this works well because they're also battery powered for several hours.
Oh, fantastic.
Yeah, so that's definitely a good thing. And of course, we don't even need to have a fancy oxygen tank attached to it. They also have the ability literally to concentrate oxygen from the air. So it's a really fantastic bit of technology. So we're very, very pleased and thankful to the Monks and the Rogers family, as you've already indicated. And to Dr. Gosowitz for making sure, that's him pictured there with me at the Rogers estate earlier this week, for the care and attention that they've paid to the Bahamas, and we're looking for great things further over the course of the next several years in the effort to try to improve healthcare for the many of us in our country and beyond. So thank you, Minister, for taking the time with us today to receive the ventilators and show our acknowledgement and thanks to the Monk and Rogers family. They themselves did not even want their names shared, and I said, we at least got to have the last name. We got the first name, but we got to have the last name. And Dr. Gosowitz was kind enough to allow us to at least show his face and share his name. So very modest family, very philanthropic, and we're very thankful to have the association. But thank you and your staff for accommodating us this morning.
Thank you. Thank you so much.
Okay.
Okay.